but I want to welcome you to our room. Hopefully you're in the right session, and we are going to be talking today a little bit about for those students that are interested in becoming a pharmacist. And I know that in the undergraduate admissions side of things, we are an undergraduate program, and then we have pharmacy with Rachel, who's here today. She'll be talking a little bit later about our pharmacy program, and we have some different things that we're going to showcase to you. And I'm going to give everyone just a couple more minutes now to get in and make sure everything is working right.
Hello, I'm Gloria Meredith, the Dean of the School of Pharmacy and Pharmaceutical Sciences at Binghamton University. These unusual circumstances do not permit us to meet together in person, but I'm still thrilled to speak to you virtually. Although the Doctor of Pharmacy degree, also called the PharmD, is a graduate degree, undergraduates are guaranteed admission into the pharmacy program, providing they fulfill certain academic requirements. Today's events will address all the details and answer any questions you may have to move smoothly from your undergraduate years into the PharmD program. So let's talk about today's event. So, you want to be a pharmacist. I can tell you that if you see yourself working on the healthcare team, taking care of patients, working and consulting with doctors, nurses, social workers, and other professionals, and improving the healthcare outcomes of patients, then a degree in pharmacy is for you. There's a misconception about pharmacists that they work behind a counter counting pills all day. That just simply is not true. Modern pharmacy practice takes place in many different locations and not in isolation. Pharmacists take care of patients in rural settings, in specialty pharmacy, in hospitals, in cardiology units, outpatient clinics, the ICU, as well as work in some other fields that didn't even exist 10 years ago. Pharmacists do research in pharmaceutical industry. They also work for the CDC and for the FDA and the National Institutes of Health. Many pharmacists go into academia and become professors in pharmacy schools. To sum up, with a degree in pharmacy, you will have endless possibilities, and Binghamton University School of Pharmacy will prepare you no matter what career path you choose. I hope we'll have a chance to meet in person sometime soon in the near future, but until then, please stay healthy and enjoy the rest of your event. Thank you.
Great, and I am going to now turn it over to Rachel Perry, who's going to talk a little bit about the pharmacy program here at Binghamton University, and then we're going to open it up afterwards for any questions that students may have. So I'm going to actually end my video here and allow Rachel to take over.
Hi everyone, my name is Rachel Perry. I'm the Assistant Dean for Enrollment Management and Student Affairs here at the School of Pharmacy at Binghamton University. That's a really long time. This means I work with students from the time where you're all at now, hey, I think I might be interested in a career in pharmacy, all the way through graduation from the Doctor of Pharmacy program. So you want to be a pharmacist, so I'm here to talk to you a little bit today about where the profession of pharmacy is going, what career opportunities there are for pharmacists, and then how the program works here at Binghamton University to easily transition you from being an undergraduate student into the Doctor of Pharmacy program. So as we all know, healthcare in the United States is changing, and I think we've all seen some pretty dramatic impacts the COVID-19 pandemic has had on our healthcare system. So you can see here that the amount of drug expenditures for prescriptions is $354 billion. That's a number most of us cannot even comprehend. But what that means is that there are many Americans that are currently utilizing prescription medications, and there's also a lot of Americans that are taking multiple prescriptions every day to manage their long-term disease states or to help reduce side effects or symptoms of something else that they're taking. we're seeing that primary care and outpatient offices, specifically in areas that are more rural, are understaffed and don't have enough providers to meet the demands of our patient population. So we're located here in the state of New York, and you'll see that we're a blue state, which means that 81% of the state is considered an underserved area. So that means we have 81% of our patients in the state of New York don't necessarily have access to a medical doctor in a primary care or outpatient urgent care type of setting. So every state has some areas that are medically underserved. So when we start to think about a pharmacist, we can think about how can we use these people who are doctoral level trained and are also really accessible to help ease some of the burden on the healthcare system. So I'm from a pretty rural town in upstate New York. There's not a hospital, there's not a doctor's office, but we do have 2 pharmacies. So when you start to really think about the locations that CVS, Walgreens, Duane Reade's, independent pharmacies are located, they're typically really accessible by the patient population in those areas. You can walk in to speak to the pharmacist. You don't need to make an appointment. It doesn't cost any money. So we really are looking to pharmacists to help alleviate some of the pressure that we're seeing on primary care clinics for things that are maybe not as emergent. So this shows that here in 2020, there are currently over 45,000 open primary care positions that are not being filled by medical doctors, nurse practitioners, physician assistants. And we can see that that problem is going to get exponentially worse over the next 5 years. So we really can look to pharmacists to help fill some of that gap in primary care delivery. So when we start to think about things like maybe antibiotics or oral contraception, those are things that could really easily be prescribed at a pharmacy, and the patient could pop in without an appointment and get those medical needs taken care of. So every state in the nation has designated areas that are considered health profession shortage areas. And here in the Southern Tier, where Binghamton University is located, our surrounding counties fulfill that need. So here in the Binghamton area, there are a lot of patients that don't have ample access to healthcare. So the School of Pharmacy is really looking to help alleviate some of that and using our faculty and our students to provide low and free cost care to many of our community members. And currently we have more than 300,000 pharmacists that are doctoral level trained that can be helped to use to fulfill the primary care deficit across the United States. So some states do allow pharmacists to prescribe medications like antibiotics, diabetes medication, oral contraception, things that you would typically go to your primary care office for. So our goal here at the School of Pharmacy is really to help to train our pharmacists to practice at the top of their license, bring them out from behind the counter. So we're all familiar with CVS and pharmacists popping pills into bottles and counting them. That's really not what pharmacists are doing any longer. We're seeing them to be more involved in patient care, and they're really the medication expert on the healthcare team. So they're able to advise other healthcare providers on what medications might be appropriate, what potential side effects could be. And as you can see here in this chart, pharmacists are the top 3 most trusted professions. So patients really do trust their pharmacist's advice and look to their pharmacist to be able to provide them with medical care. And then you compare that down to the bottom with our members of Congress who only have an 8% trust approval rating. So pharmacists are really able to step in. They are trusted by their patients. They're trusted by other healthcare providers, and they're able to provide interventions. And those interventions can save up to $1,000 for each patient that has a chronic condition that they're treating. So they're able to find medications that work appropriately for that patient population. So for example, let's say we have someone that gets diagnosed with diabetes. That's a disease that's treated with medications. So pharmacists are able to work with those patients to talk about lifestyle changes like nutrition, exercise, but then can also make sure that their insulin dosages are appropriate and working the way they should. So you don't want to take too much of a medication, because if it has bad side effects, that's not good. But there's also a point where your insulin levels will no longer be worth that extra cost. So they can help alleviate some of that cost burden on the patient as well. And like I mentioned, some states do allow pharmacists to prescribe. So there's currently 13 states in the US that have pharmacists fully integrated into that healthcare team. So they have provider status, and they're able to work on patient safety and quality of healthcare. So pharmacy is a really rewarding career. Pharmacists are doing a lot of direct patient care. So that is even happening in the community pharmacy, where they are counseling patients on medications, talking to them about potential side effects or alternative medications, as well as advising patients on over-the-counter medications, herbal supplements that they may be taking. They're also really involved in meeting vaccine quotas. So pharmacists are able to immunize. So specifically when we think about things like the flu vaccine, pharmacists are really able to help get our patient population immunized. They also advise other healthcare professionals. So one of our faculty members is a critical care pharmacist, and he works in an emergency room. He is on the team whenever someone comes in that has fallen and has a brain bleed. So he recommends the medications to the emergency room physicians to make sure that that brain bleed stops so that we can keep the patient alive, but also so that we don't stop all blood flow. So there's really a finite line there, and he's recommending different medications based on what other medications that patient is taking, as well as calculating the dosage that's appropriate for that patient based on gender, weight, and again, other medications that they're taking. They can provide expertise on composition of drugs. So if a patient has an allergy to a non-active ingredient, pharmacists are able to compound medications from scratch, and they can help to ensure that our patient population doesn't have an adverse side effect to a medication because of something like an allergy. And they really work to increase access to healthcare. So like I said, you can pop into a pharmacy, you don't need to make an appointment, it doesn't cost any money to see a pharmacist, and you're able to get advice on medications as well as get immunizations. So we all are really familiar with CVS and Walgreens, but there's really a large variety and a huge spectrum of opportunities for pharmacists. So yes, of course, you can work in community or retail pharmacy, but you can also work in a clinic or doctor's office. A lot of pharmacists will see patients on an appointment basis, just like a physician would. And in some states, they are able to order lab work, they're able to write prescriptions, they're able to change prescriptions. You can also work in a hospital or institution. So a lot of hospitals will have pharmacists fully integrated into the healthcare team. Pharmacists are also the people that do all of those IV bag preps. So if you have ever seen or been in the hospital, anyone who's receiving medications in the hospital, that's typically going through the pharmacy team before it gets administered. They can also work in long-term care facilities like a nursing home. They can work in pharmaceutical industry. So that would be a drug development or vaccine development. So they might be involved with clinical trials or working to get new drugs on the market. You can also work for the federal government, so the FDA, the CDC, the Veterans Association, all of those are federal agencies that hire pharmacists. You can work in the US Public Health Service, the Indian Health Service, and then you can also specialize as a pharmacist. And I think this is something that's surprising to a lot of students. We all know that medical doctors can specialize, so you could be a cardiologist or a pediatrician, but you could also be a cardiology pharmacist or a pediatrician pharmacist. You can be an organ transplant pharmacist, you can be a veterinary pharmacist or a nuclear pharmacist. And so there's a lot of opportunity for you to specialize in a specific area if that's something that you're interested in doing. So how do you become a pharmacist? So the licensing exam requires that you have a 4-year graduate level Doctor of Pharmacy degree. So all people that want to become pharmacists need to have a PharmD degree, and you must pass a national licensure exam to become licensed in the state that you wish to practice. We do not require a bachelor's degree to enter pharmacy school, so that makes us pretty unique compared to all other graduate level programs. Here at Binghamton University, we have something called the Pharmacy Early Acceptance Program, which guarantees Binghamton University first-year students entrance in the Doctor of Pharmacy. So if you are an accepted student or you are hoping to be accepted to Binghamton, you will be someone that, as long as you maintain the minimum requirements, will have a guaranteed seat in the PharmD program with us. The program also offers a lot of flexibility. We know that everyone has a different path to get to pharmacy, and some students are right on the path. They know exactly what they want to do. So they might come in after 2 years of completing prerequisite courses. Other students might want to have a more traditional experience as an undergraduate. So they might do 3 years as an undergrad. And then we also have some student athletes or students that want to study abroad. And so you can also take 4 years as an undergraduate and get a bachelor's degree and then come into pharmacy school. We also have a couple of really special programs where students can do an accelerated bachelor's degree and PharmD degree. So those are for students that major in biology, chemistry, or biochemistry. You'll take your first 3 years in Harper College, and then the first year of pharmacy school will transfer back to Harper College to complete your bachelor's degree, and then you'll go on to finish your PharmD. So you'll get a bachelor's degree and a Doctor of Pharmacy degree in 7 years instead of 8. So there's a lot of benefits for students that do the early acceptance program. The first is that you have a guaranteed seat. It's really nice to know, okay, I don't have to do anything else. This is guaranteed. We also waive the pharmacy college admission test for every applicant that has a 3.0 GPA or higher. So that is just a B. So as long as you have a B average in Harper College in all of your coursework, you don't have to take that exam, which is nice. It takes away some of the pressure and saves a little bit of money. You also have the flexibility to choose the path that's best for you. A lot of programs are 0-6, which would be a 2+4 type of program, but we know that cookie cutter doesn't fit for everyone, and so we want you to be able to make your undergraduate years whatever it is that you want them to be. So college is supposed to be a time of exploring, figuring out what you want to do, figuring out who you are, and not everyone can do that in the same type of pathway. So whatever it is that you need to do well in those prerequisite courses and feel like you're ready to come to pharmacy school, you have 2, 3, or 4 years as an undergraduate to do those. We also have a lot of individual advising and programming. So I meet with all students that are in the PEAP program, have office hours on the main campus, and we host special events for those students throughout the academic year. So some of those events will be in the pharmacy building, some will be on the main campus, and then we also connect all of the pharmacy early acceptance program students with current students in the program. So you have kind of a big SIB that can help you along the way, talk to you about what it's like to be a pharmacy student. We also encourage all students to get involved with the Pre-Pharmacy Association. Again, we do a lot of collaborations, lots of events, and so that helps make the transition to pharmacy school really easy because you already know students in the program, you know the other students that are also coming to pharmacy school, but you've had a chance to meet with me, to meet with our faculty members, so the transition is pretty smooth. These are our prerequisite courses, so I'm not going to go through all of them. They are available on the website. It is important to know that we do accept AP credit or college level credit that you took in high school. So whatever Binghamton University gives you credit for, you have fulfilled that prerequisite and you would not need to take it again here at Binghamton. The other thing that's really nice about the early acceptance program is we help students register for their prerequisite courses. So we guarantee that you get into all of these courses the semester that you want to take them to ensure that you're on track for the path that you have chosen. So the tuition and fees for pharmacy school is higher than undergraduate tuition. So if you are a New York State resident, the tuition is $26,510. We do have scholarships available for students. So all accepted students from the early acceptance program are guaranteed a scholarship once they come to pharmacy school. And that scholarship is something that you'll get all 4 years in the program. So that definitely helps offset some of that tuition. We also have national scholarships on our website. So there will be specific pharmacy scholarships as well as scholarships for different minority populations, for anyone interested in health professions. So we also help students fill out those applications if they need some additional funding assistance. And we are lower than private schools. So although the tuition is more expensive than what you're expecting to see for Binghamton, we definitely are more affordable than the private pharmacy schools in the state. And the good news is that pharmacists are looking at really a great salary once they graduate from pharmacy school. And according to Glassdoor.com, pharmacist is the #2 and #3 highest paying job in the US. And you'll see that between the two positions, there are over 4,500 open vacant pharmacy positions. So there definitely is a demand for people who are becoming pharmacists, and you will be able to find a really high paying job once you graduate from our program. So our pharmacy school is really special for a couple of reasons. One is that we are in a brand new ultra modern building. We moved in about 1.5 years ago. So we have really amazing facilities for students to learn in. We have a simulation community pharmacy that has robotic dispensing. We have a hospital pharmacy that also has a 797 compliant sterile compounding lab. We also have high fidelity mannequins. So these can do essentially everything that a person can do biologically. They blink, they talk, they have blood pressures, heart rates. So these really allow you to practice your skills on that healthcare team in a simulated environment before working with real patients. We have a lot of really high quality faculty that have taught in medical schools, pharmacy schools. A lot of them have NIH research funding. A couple of them are working on projects with Medicare and Medicaid databases. And all of our clinical faculty that are pharmacists also have practice sites that they go to 1 to 2 days a week that they're also able to take students to. We also have a small class size, so we max out around 90 students per class. So that gives us a 10-to-1 student to faculty ratio. So what that means is your faculty members know your name for better or worse, but it really does provide the opportunity for close mentoring. It's going to be a little bit different experience than being an undergraduate because the faculty member you as their future colleague. We also require students to complete the national certification through the American Pharmacists Association. Immunization certificate is taught in the first year of the program. Pretty much all pharmacy schools are going to provide students with the immunization certificate, but we also provide the diabetes certificate as well as the medication therapy management certificate. And these are really special because those are services that pharmacists are able to bill insurance companies for. So those make you highly competitive in the job market, as well as if you're looking into doing a residency program. We have an emphasis on interprofessional teamwork. So right in your first semester, you're matched with nurse practitioner student, social work students, public health students, and you'll all work on an interprofessional team. So you'll do a couple of really cool simulations. You do a poverty simulation, and then you'll also be working with the medical students from SUNY Upstate University in Syracuse. They send about a third of their third-year class to live in Binghamton for their clerkship, and you'll do an emergency disaster drill. You'll do other simulations with mannequins. We have an opioid simulation, and so those are really important because it allows you to work with those students, and they get to also learn about what pharmacists bring to the table on that healthcare team. We also require a capstone research experience, and this is something that students will do in groups with other students as well as with a faculty member, and it will begin in your third year of the program and will culminate in the fourth year with a poster presentation. So this really gives students true research experience. It allows you to really learn about evidence-based medicine, and our hope is that some students will ultimately get a publication out of their capstone experience. We are the first building that has been opened on the university's health sciences campus. So like I mentioned, we are located in Johnson City, New York. It's about 2.5 miles from the main campus. The Decker College of Nursing and Health Sciences is also moving to the health sciences campus. And we do have about $30 million in funding to also build a research and development building on the health sciences campus that will house additional research labs and provide additional opportunities for students to get involved in research. And we're also positively impacting the rural community here in upstate New York and the Binghamton region. So many of our students are involved in community projects, including blood pressure clinics, immunization clinics, drug take-back events. So there's really an opportunity for students to have that feel-good moment of I'm positively impacting someone's life who might not have otherwise had access to healthcare. So here are just a couple of pictures of our students at different events in our community. So they're very involved with national pharmacy organizations. We have funding to send students to national pharmacy meetings and conferences, but they're also involved with different events throughout the community, so community, local schools or different community events like the Heart Walk and things like that. So here is my contact information. So if you do have any questions, you can definitely get a hold of me. But I am going to have Janae read off some questions so I can answer them while I have you on this webinar right now.
Thanks, Rachel. We have a lot of really great questions. Hopefully we'll get through as many as we can. So one of them is, do students who wish to pursue a career in pharmacy and go for the PharmD program typically double major? If so, how would you say they manage to handle the workload?
So I would say typically students do not double major. About half of our students enter the Doctor of Pharmacy program having completed only the prerequisite courses. The other half will come in with a bachelor's degree, but typically those students are pursuing science degrees just because that's where their interests lie, and those courses overlap really nicely with the prerequisite requirements. You can major in anything that you wanted. So if you wanted to be a theater major and take those prerequisite courses, you definitely could do that. But I would encourage you to meet with Harper Academic Advising as well as myself. And we can certainly look at what coursework you may have already completed in high school and kind of figure out your individual plan depending on what you want.
Great. So another student has asked, I want to do the early acceptance program. Is the admittance into this program automatic?
Yes, so you will just have to let us know that this is something that you're interested in doing. So if you have been accepted to Binghamton University for the fall semester, you will be receiving an email from me shortly, probably in the next month or so. So we'll set up a time to meet at your orientation session this summer. We'll work on your schedule for the fall semester. And then in the spring semester, I send out another reminder and just say, hey, are are you still interested in doing this program? So we collect your information again after you've had some coursework in your first semester. And then you do have to come and interview with us. So we will typically do the interview in mid-February of your second semester. We interview all of the early acceptance students together. I know the interview can seem like an intimidating process, but it's really just designed to make sure that students understand the profession of pharmacy, and it really gives you an opportunity to meet all of the other students in the program as well.
So Nicole asked, are transfer students able to apply to the 6-year PharmD program?
Yes, so depending on what coursework you are transferring in, you should be able to complete everything in those 2 years leading up to entering pharmacy school. We do accept community college coursework, so if you're coming from a community college, all of that coursework will transfer and be able to fulfill prerequisite requirements. And sometimes students might be missing a course or two, so we also accept summer coursework. So we can always get a plan together for you individually to see how we'll fit all of those prerequisite courses in, but it's definitely possible to be a transfer student and do a 2+4.
Great. We have another wonderful question about how do I know being a pharmacist is right for me? If I am not 100% sure, should I not go into the profession?
So that's a great question. I think a lot of us enter college not totally sure what we want to do. So that is a completely normal feeling that you have. I think the best way to figure out what it is you want to do is really to start to look into different opportunities to maybe shadow or do informational interviews. So I would encourage you in your first semester to get involved on campus. I would encourage you to get involved with the Pre-Pharmacy Association. They will regularly bring in pharmacists to talk to students about what they do. And here in the pharmacy school, we host programming for undergraduate students. So for example, before we moved to online learning, we had a veterinary pharmacist come from Cornell and do a lunch and learn to talk to students over lunchtime what her job was. So there's definitely a lot of opportunities to learn more about all of the different health professions, including pharmacy, and it is completely okay to not know what you want to do. Lots of students come into pharmacy school not exactly sure what they want to do as a career. So part of my job and part of what my office does is to really help students figure out all of the different opportunities there are in the profession of pharmacy. And my office also works really closely with pre-health advising, and pre-health advising has lots of different events for all of the health professions. So there will be ample opportunity for you to learn about all of the different health professions and what each one has to offer.
We have another question. Is it difficult to find a job in pharmacy if you received a degree from a different state?
So it's not. New York State is actually pretty competitive when it comes to finding a job in another state. And part of that is because we have extensive compounding requirements. So most states for licensing will require a national board exam. New York State requires on top of that a compounding exam, which is actually going and doing a bench compounding like live exam. So students that are coming from New York State are typically really easily able to find jobs in other states because of that compounding experience.
Can you go more in depth about the Capstone Research Project?
Certainly. So the Capstone Project is something that you will work with 3 other students. So the students are able to pick their own group members, and then all of our faculty members and preceptors that are offering capstones will essentially lay out the menu for all of our students. The students rank their top choices, and we try to match as many students to their top choices as possible. So our last round of capstone matching, we were able to give every group their top first or second choice. And then you work on that with your faculty member. So it could be something that's in the lab and you're working on a bench project. It could be looking at a Medicare database and trying to figure out how that data applies to patient populations, or it could be actually going to a clinic and working with patients. So you kind of get to pick whatever it is that you're interested in, and you'll work on that periodically throughout your third year. You get a 1 credit experience for the fall of your third year, as well as the spring of your third year. And then one of your APPE rotations, so the fourth year is all advanced rotations, and those you're out in the community. One of those 6-week experiences is designated for capstone. So it really is an extensive research experience that you'll get that culminates over your third and your fourth year in the program.
Great. So one of our questions was, is it too late to apply for PEAP? And I believe that they're probably talking about there being a new fall student, but we also have a student who's interested in joining Binghamton in the spring, and would like to know if early acceptance would be impacted by that.
So if you are a spring admit, you can absolutely join the early acceptance program. And also if you are in the program with SUNY Broome, so the BAP program, you can also be in the early acceptance program as well.
Great. We have a few more questions. Not getting a bachelor's degree affect me versus just going straight to the PharmD program?
So I get this question a lot. So there's pros and cons to both. The nice thing is once you have a bachelor's degree, it can never get taken away. So you will always have that as a fallback. But the majority of our faculty members that are pharmacists do not have a bachelor's degree. They only have the Doctor of Pharmacy. So it's really going to be up to your personal preference. The nice thing is if you go straight for the Doctor of Pharmacy, it does save 2 years of tuition and housing, and you can start practicing as a pharmacist 2 years earlier. But some students are not ready for that and they need a little bit more time as an undergrad, and that's okay too. So it's really just going to be up to you and going to depend on what you want to get out of your time as an undergraduate student.
Great. Nicole asked, is it okay to take prerequisite courses as a summer class at a community college, or is it recommended to take those at the university?
So we would recommend taking all of them at Binghamton University, but sometimes they just won't fit into your 2 years, or you need to spread them out because they're difficult and you want to make sure you get that minimum GPA, or you say, oh, I've never heard of anthropology and that sounds really cool. I want to be able to take that class. So we do accept courses taken over the summer at community colleges, but you'll just want to get pre-approval before you take those courses to ensure that they'll transfer.
I also want to just jump in there because I know if you are a first-year student, if you haven't been taking college courses, that summer course, taking them in a truncated format in 5 weeks can be very big of an adjustment. So I'd urge you to talk to your advisor about the feasibility of doing that based on your academic background. Rachel, we have a great question from one of our anonymous attendees. What are good traits to have as a pharmacist?
So pharmacists, you definitely want to be empathetic. You're working with patient populations that a lot of times are really vulnerable. We're also looking for people who have strong communication skills. A big part of the pharmacist's job is to be the person that's communicating between a patient and an insurance company, or a patient and a medical doctor. Science skills are definitely important. Math skills are important so that you're able to calculate dosages. And you also want to have high professionalism skills. So being able to stay composed in stressful situations, being able to talk to patients who might have different ethnic, racial, education levels than you. All of those would be important skills.
Thank you. We have one more question, and can we go more in depth on the 7-year PharmD program, which includes getting a bachelor's in biochem?
So there are 3+4 pathways set up for biology, chemistry, and biochemistry. So students will need to complete all of the pharmacy school prerequisite courses, as well as the general education course requirements. And then the first year of pharmacy school will transfer back to fulfill your remaining upper level electives. So For each of the majors, there are going to be a little bit different nuances as to what transfers back, but you will be able to transfer back 28 total credits. So it's about an entire academic year of coursework, and that can be used to fulfill your general upper level requirements, as well as specific requirements for the major. So we do have the programs that are going to be posted on the website, and I'll also have them this summer at orientation. So students will be able to see exactly how their first year of pharmacy school will transfer back and see specifically what courses will be fulfilled with the pharmacy coursework.
What are the cost benefits of getting a PharmD? How much would I realistically have to pay out of my pocket?
So for your undergraduate, you're going to really need to talk to financial aid to see what you might qualify for your financial aid package. Once you come to pharmacy school, unfortunately, you're no longer able to use TAP or Excelsior. So the tuition is rounding up about $27,000. We typically are able to offer Binghamton students anywhere from $5,000 to $10,000 each year that they're in the pharmacy program. So we do provide financial aid that way, and then students will also qualify for unsubsidized loans. Really where the big cost differentiator comes in is when students are selecting their housing. So here in the Binghamton area, there's a variety of off-campus housing that students can choose to live in. We have some pharmacy students that tell me they pay $450 in rent, and then we have other students that tell me they pay $1,200 in rent. So I always encourage our students to really consider what they need when it comes to housing and their living expenses, and to really try to stick to a budget that's going to work for them so that they don't take out additional loan money that they didn't really need. But realistically, let's say you are going to take out the full cost of your pharmacy education and without a scholarship assistance, it would probably be close to $100,000.
Sorry, we have one more question.
Okay.
How would scholarships work for transfer students?
So any student that comes into the PharmD program, it doesn't matter if you were a transfer in undergrad or if you started at Binghamton in your first semester, all students that take some prerequisite courses here at Binghamton University for at least one semester are eligible for scholarships once they come to pharmacy school. So we have a scholarship committee that will review your merit, and so that'll be your grades, and then we'll also have financial need-based scholarships. So we'll be able to see, based on your FAFSA, if your income would qualify you for a merit-based or a financial need-based scholarship, excuse me. But we typically are able to offer Binghamton University students pretty high levels of merit scholarships because they are such high quality students.
Thank you so much. And actually, I'm going to go live again. It looks like we've answered all of the participants' questions so far. So I want to thank you, Rachel, for coming down and joining us. And I want to thank all of our participants for attending. If you should get home and you wish you had asked any questions, please reach out to us. And I want to thank everyone for attending. Oh, it looks like we have one last minute question that came in. Do PEAP students receive any scholarships, grants, or any other types of aid?
So all of your undergraduate aid while you're taking the prerequisites will be based on your FAFSA. So the university's financial aid office will let you know specifically what you would qualify for. And then once you come to pharmacy school, all Binghamton students will qualify for some type of scholarship through the School of Pharmacy.
Great. Thanks, Rachel. And I know that we have lots of different students that are in the audience watching the webinar today, but I want to thank you again for taking the time, and I wish you all the best of luck in your search process. We are here to answer any additional questions that you have, and you're welcome to email us at this point. Thank you so much and have a great afternoon.